And I'm going to ask everyone to mute themselves.
Mute. All right.
Oh, it's a bunch of folks in there. Okay, so we're going to get started. My name is Leticia Vaca, and I'm the founder and CEO of Urban Health Group LLC. With everything going on in our community, I thought it was really important to have the discussion around COVID-related concerns, questions about how we can protect ourselves, and also the vaccine. So it hit the states this week. So I wanted to create the space where Black, Indigenous people of color can come in and discuss openly in a very relaxed environment, but also with physicians that are in the ER. So we have 3 ER physicians in this call right now. So I'm gonna ask them to introduce themselves. So again, this is gonna be really laid back. If you have questions, please add it in the chat so that I can moderate with the team. But again, thank you guys for joining in. I'm going to start with Dr. Marcus Williams. He is the medical advisor for Urban Health Group, and I'm going to ask you to help introduce the other colleagues you have on the call.
Hi, thank you for that introduction. Yes, my name is Marcus Williams, African-American male, currently working in the emergency room within the Bay Area. Very excited to be on this call. Thanks for having me. I have 2 of my good friends, Tarek Trivedi, as well as Benjamin Thomas, doctors as well, coming in, helping me out. So I'll let them introduce themselves as well. We'll start with Tarek.
Hi, how's it going? Thanks for having me on the call. My name is Tarek Trivedi again, like Marcus said. I work, I'm originally, I'm Indian American, originally from Detroit, Michigan. I work currently as an emergency physician in San Jose, Los Angeles, and I do a little bit of work on a Native American reservation in Arizona.
Thank you.
And Benjamin Thomas.
Hi, everyone. Thanks for having me here. Really looking forward to this platform and discussion. My name is Benjamin Thomas. I'm an emergency physician out here in the East Bay, San Leandro, California. I'm Nigerian American, and I'm looking forward to kind of discussing, the current topic and kind of getting your opinions, questions, etc. During this meetup.
Thank you, guys. Thank you, doctors, for being present today. The first question I have is if you can talk a little bit about what has changed in the ER, especially since COVID. I imagine there's a lot of changes you're experiencing. Can you give us some insights on your emergency experience now?
Well, I'll start off. I'll say, that's definitely a loaded question because, there's been so many changes from, amount of patients we're seeing to protocols, to staff, to where staff is being located. Things are really, one of the first times I can say in emergency medicine are kind of changing on the fly, especially early on. As far as big changes, I think that one will see as far as walking into the ER outside of the standard protocols of, getting your temperature checked, making sure you have a mask on. This is even before you walk into the ER, this is walking into the hospital. These are now standard protocols that I think some people, if you don't come to the hospital a lot, won't really be aware of. I think another one that's really affecting people is the ability for ERs to allow what am I trying to say? Guests, plus ones, they're not really allowing, patients to have people come into the ER. So I think those are some big kind of changes that, people will notice kind of immediately walking in.
Okay. So no visitors, like if you're not feeling good, folks are really having to show up by themselves, right?
Yeah. Correct. Yeah. I'll let Ben take it. Yeah.
Piggybacking on that, that's been one of the incredibly difficult things about being an ER doctor during this pandemic and having very sick patients come in, not being around their loved ones, being admitted to the ICU or hospital, having to talk to them, via Zoom or FaceTime, whatever means, and not actually having an advocate for you. And that's probably been one of the most challenging things I've seen as a provider. The other thing I've noticed is that we've seen a lot of people not come to the hospital for fear of getting COVID, so patients who have chronic medical conditions that rightfully need to be taken care of or seen in the hospital are deciding not to come because the fear of COVID is so widespread, rightfully so. And the concern of themselves contracting COVID has been one of the reasons we've seen an increase in mortality of those having heart attacks. We've seen people have late effects of stroke. People come in with, sepsis and kind of your standard, but come in much later and already deal with the damage and consequences of not having come to the hospital earlier.
What would be a recommendation for folks that are delaying or, afraid? Would you say still come or call their primary care doctor? What can people do who have chronic conditions that need to be addressed, but afraid of getting COVID in the hospital?
Yeah, I think that's a great question. I'm glad you bring that up because there are other options. There's telehealth. There's calling your primary care doctor. There's these call-in hotlines to talk to a nurse. I think like Dr. Williams and Dr. Thomas are saying, all ERs have kind of instituted these policies that no family, and I think a lot of people are hesitant to come in because they're scared they're going to be alone by themselves, and potentially if they don't have COVID, they may get exposed to it. But at the same time, people are at home with these exacerbations, their chronic conditions getting worse. I think speaking to their primary care doctor, if that's an option, that's not always an option for everyone. Getting primary care doctors, I think on the phone is hard. I suspect that may have become easier now with Zoom and kind of, these telehealth.
The Zoom meeting is on.
Yeah.
But this meeting?
Sorry.
Sorry, please mute your mics when you join in. Oh, I can mute all. You'll have to open your mic, Tarek.
Sure, no problem. Yeah, but I think that reaching out to these telehealth options is one thing, but I think at the same time I want to put the message out there that we have good protocols, and your chance of catching COVID from the ER is actually probably going to be pretty low, provided that that your hospital has reasonable protocols. We have, in some hospitals that are small that don't have big waiting rooms, we have people wait in their cars, and then we call them by phone and have them come out and come into the ER, so we can maintain that social distancing. Other places we put a mask on everyone and try to keep private rooms and space as much as possible. We have tents set up at some of the bigger hospitals where they've set up socially distanced sort of stations at which people can wait. So I think there's overall low risk in catching it in the ER.
Okay.
Yeah, and kind of double off of Tarek's, kind of telehealth. I think that, kind of the original question is how these chronic conditions can kind of get some better access. And Tarek brought up a great point, which I think is telehealth, which a lot of facilities or hospitals are trying to use more now, especially with the coronavirus, so I think trying to, again, like everything, like Tarek said, getting access as far as primary care is very difficult at this time. Not only are the doctors low in numbers, access is obviously hard. So, it's easier said than done, but I think telehealth is one of the things that is really building now and is very helpful with what we have going on.
And when you're referring to telehealth, that means can you clarify what telehealth means? Because it is newer for the community to interface with their care in that way.
Right. Yeah, I'd say this probably always been a telehealth or a small version or a lighter version at some institutions, as far as being able to call on the phone, speak to a nurse, that nurse being able to get you to a doctor, or kind of being able to email your doctor, text message, etc., via app, is now really picking up and really keeping patients in contact with their doctor, their facility, etc. So that's kind of what I mean by telehealth. I'm not sure if Tarek has some other ideas or other modalities.
Can I say
Yeah,
something, please?
spot on.
I'm a retired geriatric nurse practitioner with Kaiser. I retired from Kaiser years ago, 2012. And so I've used telehealth sort of kind of like this. Kaiser has its own kind of visual that you can talk. So that was great. And I haven't had to see my primary since then. In fact, one time I wanted to show them a lesion that I had on my skin, and I showed her over the phone, and she said, "No, you got to come in," because they had to make sure it wasn't malignant.
Yeah, so it can be really helpful, it sounds
It's
like.
very helpful. I would think, especially with mental health. I worked with a psychiatrist, and so with mental health, and I see there's a question here about that. What's
Yeah.
happening as far as, yeah.
Okay.
Yeah,
Thank-
Zelma, we've actually seen an increase in kind of access overall across different systems, here in the Bay Area, Kaiser, Alameda Health System, Sutter, probably the big three players when it comes to access to healthcare. And we've seen people use it very widely across different demographics and age groups, and just provides another option. 'Cause sometimes you just have a question and you don't need to have to drive into the office and wait in line, wait in the facility just to get a few questions answered by your doctor. So it has been helpful for many people who kind of have chronic medical conditions and are just trying to kind of get their best handle on it.
Thank you. Thank you. So I have a question for all the doctors. And I use the acronym BiPOC, BIPOC, which stands for Black, Indigenous, People of Color. Why do you think it's critical for the BiPOC community to know about the coronavirus, thoughts on vaccines and patients' rights? What do you think is important for the community to know about, especially what's going on with this pandemic?
I think, as far as the number one concern that I come across is, definitely concentrating within those areas are very hospitals that are very much at the wit's peak of their equipment, their the tools that they have. I'll say a lot of the hospitals in the BiPOC community don't have a lot of beds left, don't have a lot of ICU beds left. So I think that knowing access, the ability to get proper care right now might be a little bit more difficult. Therefore, practicing social distancing, practicing, hand washing, using a mask is just that much more important, I think, is the first thing that really comes to my mind.
I think the first thing that comes to mind is that there has been a ton of misinformation and mismanagement of this pandemic. With the previous outgoing administration, it's easy to argue that there are a lot of missteps in how this pandemic could have been managed and handled when it comes to masking guidelines, when it comes to kind of transparency about the severity and seriousness of the disease, working the ER. Granted, we still have mask mandates for all our patients. You're talking to patients, there's still a healthy dose of misinformation and miseducation on how the virus is transmitted and what actually social distancing means. I think now, kind of moving forward, I think what's most important, especially for communities of color, especially the data shows that we are by far communities that are most affected by this disease, is that we have to kind of engage in social distancing, engage in washing your hands, don't join in community gatherings like Thanksgiving. You know, it was really hard for me and my family not to get together this past Thanksgiving, but really hampering and hammering those messages down because, you know, a lot of communities of color don't have the luxury of being able to work from home. You know, maybe they're an essential worker. They have to go to work day to day and they're exposed to people. So with that risk, with knowing that, I think it's inherent for our communities to be more vigilant in those practices to keep, you know, ourselves safe.
So being that nuisance person who's like, no, 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 I can't come. No, 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 please put your mask on. I want to ask a little bit more detail of when we hear the words like, this community is more impacted, more affected. Can you really paint a picture of what that looks like from the ER standpoint, what you're seeing in providing care to folks in the emergency rooms?
Yeah, I mean, I can answer that question. I think that, you know, there's no secret. There's a ton of disparities in how this pandemic is affecting the population. And, you know, early on when the scare kind of went up, you know, with what happened in New York out here in the West Coast, I think everyone kind of got scared and you know, we saw very, very little COVID. But then as things started picking up, it was the essential workers, it's the people driving Ubers, the people working in the restaurants, the people that have to have these jobs that, you know, that are coming in, that they have to come into work with. They can't really, you know, have the luxury of working from home. I think that part of that has to do with why there's been a significant disparity. As well as, you know, I saw some stuff on the chat there about misinformation and what we can do to stop the spread. I think bad leadership was one of the big issues that we faced, and you know, from the politicians as well as from the public health agencies. I think there, you know, there initially should have just been a mandate to everyone should wear masks no matter what. There's really no harm in that. We've learned since then that they've been effective, but I mean, it was almost obvious that you know, preventing the spread of droplets at least wouldn't harm, if not at least help. As we move on to, you know, discuss disinformation, I think one of the things you brought up is the vaccine. And I think because there's been, you know, healthcare disparities are so common that there's, you know, especially from communities of color, there's often distrust with the medical system, with this whole, you know, are they just using me as an experiment? Do they even know what they're doing? Would they do this for other communities? And you know, honestly, I think it's going to require a lot of leadership from people like you, people like ourselves, to get the message out there that, you know, this vaccine is going to work. This is really only our only way out. And you know, the destruction and devastation that we've seen so far, we need to sort of let it halt. There's been a lot of sentiment like, you know, oh, we should just let COVID, you know, do its thing and it'll burn itself out. I mean, that's when you see the emotional and the toll on families, that's unacceptable. You know, I mean, there's so many people dying earlier than they should have, or becoming handicapped far earlier than they should have, because it's not just death, you know, it's also the fibrosis and the long-term effects on the lungs, the need for oxygen tanks. And we've seen it all, and it's devastating. So I think, you know, promoting this vaccine and showing that it's safe, I don't know, campaigns maybe on social media, physicians and nurses, people of color going on and maybe, you know, even showing that, you know, hey, I'm getting this online. I think I saw Ben Thomas post something on social media, and that made me smile, because I think that things like that are really going to be required. So.
Thank you. And that's part of the reason for this platform is, you know, I know you all personally, these physicians, and I listen to people I know. Most people do. Like if I have an issue, I'm calling my mom, I'm calling whoever I know in my immediate communities, and creating the space where folks can have access to information, not to necessarily push an agenda, but just say, do you have all the information you need to make really good choices in care? And with that being said, how can people best protect themselves? I mean, I see the, you know, the jail, what is it called? I'm like blanking right now. Hand sanitizer, the mask. Are there additional things that people can do to kind of slow it down, but ultimately like keep themselves healthy?
Yeah. Oh, yeah, I'll say, I think you hit obviously a lot of the big ones. The vaccine is obviously one of the big things that, docs will be discussing with patients, and the vaccine will not obviously, I shouldn't say that, the vaccine will give you immunity so that you can no longer, hopefully, no longer really suffer from the virus. However, it won't stop you, to my knowledge, and please, Dr. Trivedi, Dr. Thomas, stop me if I'm wrong, or please chime in. Even after getting the vaccine, which will help you, it won't stop you from spreading the virus. I think knowledge, truly understanding, as much as you can about the virus is important. Understanding that you don't have to have symptoms to, actually, to have the virus is very important, because that can keep you to practice other things that, we're also asking, social distancing, et cetera. So, I'm sure Dr. Trivedi, Dr. Thomas got some ideas on this as well.
What we know from the virus is that it is respiratory droplet spread, meaning that if you cough, the virus is in the air for a period of time and then falls to the ground. There are some reports that it's also airborne, meaning that it can stay in the atmosphere for longer periods of time. And some of those, some of that data does look legitimate. So with that said, the biggest thing I would say is masking. One of the biggest things, actually. And, we all go to the grocery store, you see people with their masks down, they don't fit, or like, they have like a little hole in the middle. Like, nah, that has to stop. If you're gonna wear a mask, cover your nose, make sure it properly fits. That's a huge kind of thing. Exactly. Thank you, Zama. I think that's one. The second thing, vaccinations, as Dr. Williams had mentioned, is going to be critical to preventing the burden of the disease, and also hopefully decreasing its spread. What we know of the vaccine is that it is about 94%. This is the Pfizer vaccine, I should say specifically. It's about 94% effective in preventing people from developing severe disease. What is severe disease? Requiring a ventilator, being on oxygen, having kind of a significant burden, requiring a hospital stay from the coronavirus. What we don't know of the vaccine is whether it prevents spread. We don't know that data. So if I were to get my vaccine shot tomorrow, and then 2 days from now get contaminated or infected with the virus, I may not develop severe disease, but I don't necessarily know if I'm going to be a carrier to give the disease to other people. And speaking of the vaccine, I think one of the big things, especially in communities of color, is really outreaching. There have been generational trauma around kind of medical institutions and communities of color, Black, Indigenous people of color. When we come to Tuskegee, Henrietta Lacks, the list can go on. And it's understood. I completely understand why people don't want to get a vaccine, don't want to jump into something that they're not completely sure of, when there's already an established mistrust of the system that they're working in. But with that said, as Dr. Williams had mentioned, this is our way out. This is the light, hopefully, at the end of the tunnel. We've suffered a huge burden across the nation, across the world, from this pandemic. And, my hope is this vaccine kind of ushers a way out of this pandemic. We're still going to need to wear masks, we're still going to need to social distance, we're still going to need to follow guidelines. But if we can stress the importance of getting vaccinated across different age groups, across different communities, that's what's going to hopefully prevent people from getting sick. And our hope is that the vaccine also helps with preventing the spread of the disease, but we still don't know that yet.
Thank you. And there's a question that I received. How long does the vaccine last in your system? And is this the type of vaccination that will need to occur, every year, every few years? Is that known information?
At this time, none of that stuff is known. Unfortunately, it's just way too early. We know that it works. We know that it doesn't get people sick in the short term. Long term, we just don't know. But we know that, I think as Dr. Thomas mentioned, it's 94%. The Pfizer vaccine is 94% effective, and it could prevent, the severe disease. But we don't really know if it's going to be something that we get annually, like the flu shot, or if this is going to be a one and done. We also really don't know, how this virus is going to change. So still lots of unknowns.
Yeah, to piggyback off of Tarek there, you were right. We don't know if this is going to be a yearly thing right now. It seems to be 2 shots. I think most of them are 2 shots. A shot you get, and then I believe 2 to 3 weeks after, you receive another shot. But like Tarek said, whether we'll have to do something in 5 years, 10 years, or if that's it, is unknown at this time.
So I have a question. What are some things that are helpful to you as providers when people are coming into the emergency room for support, especially now that folks will be coming in by themselves and maybe they can't communicate as best when they're not feeling the greatest? What have you found to be helpful in providing care when folks come in? I don't know if I'm asking this question correctly.
I would say a lot of the things that, we typically ask for, past medical history, medications, kind of a timeline of the symptoms that you've been dealing with. I can't think of anything specific that I'm now asking patients, or that I would like. Obviously, if you've been tested before, close contacts, I guess that would be one of the bigger questions that I'm now asking. Have you been close to somebody with known symptoms? Recent travel, I think I'm starting to ask a little bit more. So information, I guess, would be one of the things that, just a little bit more detail to previous things, I think is, which I know is easier asked than really be done, especially in the ER when things are very high stress and information, previous knowledge is hard to kind of bring up on a whim's notice. But I would say that would be what I would ask for.
Yeah, I think all those things, having the information available, super helpful. Sometimes having family, I think that there's a lot of people, what I've seen they do, that they bring their family in on like an iPhone, or they have like a little video chat. You see a family member. I think that can sometimes be helpful, especially sick. When somebody's sick, they may not recall the details, or they may be frustrated, and having that support that would normally be there in the room with you, that we can't really have right now because of the restrictions. I think, as Marcus was saying earlier, we're not really allowing that +1 right now in the ER. So having that person via some telehealth option is good. And then I think the other thing is just patience and sort of not getting frustrated. I think things are taking a lot longer. We're putting on PPE to go into rooms. We can't move as fast as we used to in the emergency departments. So I think patience and remembering that, I think, is always helpful for us.
Yeah, echoing what Tarek, Dr. Trivedi, and Dr. Williams just mentioned, I think the biggest thing from a provider's perspective, my perspective, is just being able to have some type of communication with the loved one, whether that be a phone, or even if you bring a tablet. We've seen, very heartbreaking stories of people being very sick, saying goodbye to their family members prior to them getting intubated, and I couldn't imagine me personally, I had my own family members and knowing that I couldn't be there, not being able to see them. So, I have stressed to patients having some type of phone, laptop, whatever it may be, to touch base with your family and be in communication with them, because it's lonely, being from that perspective and being in the hospital by yourself, scared, fighting a virus. And I think, we do our best as providers, doctors, nurses to provide empathetic care, but it's not the same when you don't have your family members there.
Yeah, and that's one of the resources that we provide through Urban Health Group, is helping people prepare for medical emergencies. What are some key information that can be helpful in ensuring that you're getting the type of care that you want? Also, as a therapist, I know that folks can't always express themselves the best when you're when your body's in pain or you can't breathe. You don't really have access to this rational mind to just give off all this information. So that's a resource that we're looking to provide directly to the community, because we know that the demand on providers is high. There's more people needing help than providers providing it. So we definitely want to make sure that folks get the best care through preparation. There are a few questions in the chat. One is, what about side effects, facial paralysis, and how to convince people to get the vaccine, even though there may be side effects?
I'll say, as far as the major side effects that I've been made aware of or kind of been told about, headaches, nausea, vomiting, diarrhea, long term, I think are the issues that I'm most concerned about, and what that will be, is obviously something that we will all find out together. I'm sorry, what was the second question? Side effects and how are
Well,
we
how do you convince people to get the vaccine when there are side
no,
effects?
I think as far as talking people into it, I think not talking people into it, but I think just giving out information. I think as far as what my plan will be, what I know or what I believe, I guess, from what I've read, people that I've trust, and giving off that knowledge and hoping that will help someone make a decision. I think Dr. Thomas brought up a good point as far as concern with trust, etc., with the vaccine. And I think that's something that I don't think I'm going to be able to figure out here, or else I'd be doing a lot more in life. But it's going to be hard. I think it's going to be hard. I think it's just going to take time for people to see other people get it, and deal with side effects or no side effects before people kind of get comfortable.
Okay, thank you. There's another question, unless Dr. Thomas or Dr. Trivedi has more input.
I was just going to piggyback off what Dr. Williams said. I think transparency is key. I think if you have a physician or a healthcare provider that you trust, really rely on them as your broker in determining, the risks and benefits of getting the vaccine. We as medical professionals are privy to, reading journals and reading, medical literature to kind of parse out what's important, what's not. What we do know from, the first wave of vaccinations across Europe, as well as here in the United States, is that most of the side effects are kind of local, meaning, pain in the arm, a fever, maybe some fatigue, maybe body aches, which is your body's response to, getting the vaccination. Granted, this Pfizer vaccine is a brand new technology, brand new type of vaccine. We don't have years of data to support, if there's any long-term effects of getting the vaccination. Typically, what we do know, most vaccines that are from an inactivated virus or kind of active virus, most kind of long-term rare side effects typically happen within 2 to 3 months post-vaccination. We do have that data from the Pfizer vaccine. about 2 months of data, and to my knowledge, there have not been any serious side effects. But again, this is a brand new technology. We don't know, years from now if there's any linkage to anything with this vaccine. And in terms of convincing people, it's really kind of weighing the risks and benefits, obviously, but also thinking about, what this vaccine is going to do. If you imagine the whole country getting vaccinated, opening up stores, jobs reopening, life continuing back to normal. I wouldn't be surprised if, airlines, hotels, maybe even restaurants start saying, do you have proof of vaccination to enter? And that's something to consider, considering, this is the first pandemic we've had in 100 years, and most people did not live or don't remember the last pandemic, which was around 1918. So I think keeping that in mind and knowing that, the medical community as a whole is really advocating for this is important. And I think the transparency and knowing the risks and benefits of getting the vaccination are going to be key to people getting it.
Yeah. And everyone's situation is different. So I appreciate the feedback on consulting your primary care doctor who knows your history, who know, what other conditions that you may be managing, whether or not it'll be good for you or more harmful for you. So definitely relying on your resources to make really good choices for yourself. The other question we have is, how do you doctors keep yourself healthy while on the job? Is there enough PPE and at home? Are you tested regularly?
Well, yeah, that again, kind of, I think Leticia mentioned a lot of the things that we're doing, especially on the job, keeping our hands washed, gelling in, gelling out. As far as PPE, I think that's been one of the issues that we've unfortunately been dealing with since this has started. I'll say, the first, kind of started with, of course, masking, then reusing the mask that we had because we were running out of masks, then kind of having limited applies of N95s. I'll say that definitely still continues from hospital to hospital. I'll say at my institution, I felt safe. I felt as though I've had the appropriate PPE, whether that be gowns, masks, facial shields, facial covers, etc., when doing the appropriate tasks. As far as our institution, as far as testing, it's something that definitely is available to us when we are symptomatic, kind of almost must do when we're symptomatic. But outside of regular testing, we're not required to do regular testing unless we come in contact with a known patient and we're not appropriately gowned, appropriately dressed. But there's no regulations or mandatory weekly, et cetera, testing. And that's got a lot to do with access, the amount of testing, and then just the overall, again, access to the test. So, that's kind of where, at least where we're at my institution.
I work with a Kaiser physician who works in a nursing home. That's what I've always done with Kaiser, worked in nursing homes before I retired. She told me recently that right now she is on call and that the nursing home requires that a test is done weekly, whether the doctor or the provider goes into the nursing home or not. So she's always there. So I thought that was interesting since nursing homes, don't have the quality of care, the nursing staff, and that's what we used to do for Kaiser, is manage the Kaiser patients with a doctor and a nurse practitioner. Dr. Thomas, how about your facility? And Dr. Tarek, do you all feel like you have enough PPE and support?
It's been up and down. I think the PPE situation initially was very frustrating. I think since, at least to the hospitals that I work in, I work for the county in San Jose and for the VA and UCLA, and it's been okay since the initial, there's all of a sudden a huge demand for these masks and for these things, and there was no supply. But since then, I think they've become more responsible. They instituted policies early on where sometimes we were reusing, sometimes we were using new methods that they're coming up with on the fly of, like cleaning the masks using the ultraviolet lights and whatnot. I think it has since stabilized, at least in terms of in terms of PPE. The next biggest most important thing is the availability of tests, and that has taken a while to ramp up. But I'd say right now we're sort of more prepared than ever before, and so I think things are moving in a positive direction. We have more supply of tests. They are offered to us whenever we'd like to have them. They're not forcing it or imposing weekly or biweekly testing on us yet. We're also kind of moving to a phase of the pandemic when I think a lot of people have already been exposed. For example, I have antibodies to the coronavirus. I don't know when I picked it up. I was never sick, but part of the testing that they offer us is to know whether or not your body has developed an immune response, and so we don't really know what to do with that information yet. Should I still be getting tested? Should I be getting the vaccine? Should I it's all sort of up in the air, but we're kind of we're working with what we have in terms of knowledge. We're operating as if that information, having had been exposed to the virus. I mean, it's kind of pretty obvious, right? You're working in ER, you're intubating, you're sort of constantly being exposed to the sickest of the sick people. You're probably going to have been exposed, and so how we're going to manage healthcare workers from that perspective, I don't think we really know yet.
And I think our exposure, especially in the ER, was greatest probably in late 2019, early 2020, when the virus was probably very early on in the States and we were unaware, and we may have thought it was the flu, late flu. And I don't think that we were appropriately gowning, gloving, etc. ourselves at that time, just because, again, knowledge of the virus. And I think Dr. Thomas, Dr. Trivedi, pointed out, that our current or outgoing administration may have not gotten the proper information, the proper knowledge out early enough for us to kind of know and kind of treat ourselves. But kind of just agreeing with what Tarek said as far as PPE, it's definitely changed. Our understanding has changed. So I think things will continue to change, especially with the vaccine. So we'll just kind of, as we've been doing, I guess, roll with the punches.
Okay, thank you. I have a few more questions in the chat. Can you get COVID from blood, saliva, tears, sexual intercourse?
You can get COVID from being within 6 feet from someone. So the answer to all of those questions is yes. I think the hard thing for people to understand about this pandemic is just that it is one of the most infectious diseases that we have all dealt with in a long time. I think Dr. Thomas brought up the swine flu of 1918. We haven't seen anything like this in 100 years. This is so dangerous. I mean, we're saying that all you have to do is having a conversation with someone else within 6 feet of each other, and you can pass the virus from one person to another. And I saw some other questions on the thread. I think these are some COVID 101 things, like how do you differentiate just a mild cough from COVID? Is it just anxiety? And the honest answer to that is, as I was saying, I probably had COVID and I never knew because I didn't have any symptoms. So COVID infection can go all the way from 0 symptoms, feeling exactly how you feel every single day, all the way to having such a difficulty breathing that you can't just get up from your bed and put your shirt on and go to the bathroom. So, I mean, every possible symptom can be associated with COVID. And that's why this has been such a difficult thing to deal with, right? People say, "Oh, I don't have any symptoms. I can go see my mom or my grandmother, or my family member who may have some conditions." But that's just not the truth, right? I mean, you can have zero symptoms and still be carrying and infecting other people with the virus. I think anxiety and mental health have definitely been ramped up because of this pandemic, both in myself, my family, and in my patients. So, and particularly those who suffer from more anxiety, I think have, they're running to the ER to get checked. I remember a patient that I'd probably seen maybe 3 or 4 times in the same week and a half, 2-week period. And of course, that person was suffering from anxiety. This pandemic is horrible. It's ruining people's lives. It's taking them totally out of their norms. All their support mechanisms are breaking down. Of course, we have sympathy. But I think the message, I try to communicate to someone coming in like that is, hey, you could have the virus. Do all the things that you need to protect other people from catching it from you. The good news is that if you're only experiencing a mild cough, your COVID isn't so bad that you require hospitalization. So the best and safest thing for you to do is to sort of continue to isolate until you feel it's passed. So and there's other people who don't get tested nearly enough. They could have all the symptoms and still be around other people. So I think we see the whole spectrum. So I want to thank everyone for putting those questions out there, because I think it is something that sometimes as medical professionals, we just imagine everyone knows, but
Right.
Yeah.
And we have a few more questions. We're also, about 15 minutes to closing. I want to honor everyone's time that they've committed to be here. So maybe like 2 or 3 more questions. And before we part, I would just ask you, doctors, to start thinking about what are some parting words? What is it important for people to know when it comes to taking care of themselves in general? And then I'm happy to share a little bit more about how Urban Health Group is supporting people and helping them prepare in case anything happens. So one of the questions is, how long does the virus exist outside the body? I'm concerned about visiting someone who tested positive over 60 days ago, but is no longer symptomatic.
I'll say that's a hard one. As far as bugs, viruses, bacteria living on inanimate objects, I assume that we're talking about, the coffee table or touching a pillow. Those are accessible, but to my knowledge, it's something that's more acute. If the patient is sick with COVID and they've slept in a bed, obviously I don't recommend sleeping in that same bed, sitting on that same couch, but I don't expect the virus to live from that one incident for over, a certain period of time. What that period of time is, I don't know that I necessarily feel comfortable saying. I don't know if anybody else feels like they got a little bit more information on that.
So what we do know is that typically the virus exists outside of the body for about 48 up to 72 hours on inanimate objects. We also know that the main ways that COVID has been transmitted has been through respiratory droplets and, plus or minus airborne contamination. The idea of getting COVID from, an inanimate object is still theoretically a possibility, but we haven't seen a large burden of disease that's connected to, you touching an object, you getting in contact with something that was in the vicinity of someone who was COVID positive, and you then getting the virus. So to answer that question, CDC guidelines, if I'm not mistaken, and anyone can correct me if I'm wrong, basically says, I believe, 72 hours after the last set of fever, and I have to double check this, or when patients have become essentially asymptomatic. But to answer your specific question, if this person who was previously COVID positive has now recovered and is no longer symptomatic, not having fevers, well past 2 weeks of their start of their symptoms, they should not theoretically be a carrier to infect other people with COVID anymore.
Is kind of a good time about reinfection. Can you get reinfection? I think that's still up in there. I think it's rare from my knowledge. Again, please, Dr. Thomas, Dr. Trivedi, chime in. Reinfection at this time is rare. So that person, technically getting reinfected within that time and then again, spreading that virus. I think we haven't seen many cases of that. Is it possible? Yes. Is it rampant? No.
So I want to thank everyone for joining in. I want to thank Dr. Williams, our medical advisor at Urban Health Group, Dr. Thomas, Dr. Trivedi, for imparting your insights and your experience on COVID-19 and what people can do to take care of themselves. Are there any parting words that you would like to share with the community about what they should know, or just, words of encouragement, whatever comes up for you?
I think some of the things that I've been hearing, and I'll try and make this quick as far as, patients that I've talked to, is a fear of the vaccine, how it works, what it's going to do. A lot of people are afraid of the vaccine changing their DNA. And to my knowledge, again, please, Dr. Thomas, Dr. Trivedi, chime in here. What we're dealing with is an RNA virus that's not going to affect your true structure. I believe that there is a DNA virus coming out soon. I don't know when that's going to happen. That may affect your DNA structure, but the vaccine that we're talking about typically, or not typically, is going to work by coming into your body, basically tricking your cells into making a protein. This protein will then be seen by other cells in your body and then make antibodies and other cells that will then recognize this protein again. And this protein is basically, you can think of it like keys that sit outside of the virus. So, once the true virus then comes into your cell, you already have these cells that you produce that see the outside keys or proteins on this virus and then attack so that you don't get symptoms. So I think that with all of this knowledge is very important, knowing how things work, so you can kind of make your own informed decisions. Somebody else brought up, getting in contact with your doc and really, believing, or, getting in contact with somebody that you really believe, hopefully a medical professional, so they know, your possible side effects, I think is very important too.
Yeah, I think just as some final words, that was a great immunology lesson there from Dr. Williams. Honestly, our understanding of immunology as physicians is good. We learned it in medical school. We learned a lot about vaccine development. We learned about how vaccines work. We understand the basics. I'm gonna trust the experts, and I've seen that they've done their due diligence. They've tested the vaccine. I trust the vaccine. I'll be getting it. I am very, very hopeful. This is the first time in a long time that I've felt very hopeful about moving past this pandemic. I know it's been really, really difficult. I've seen so much misery and tragedy and pain this year that it's changed me forever. But I think my message to everyone out there is just stay strong. A few more months. We're almost at the end of this. Keep distancing, keep using your masks, keep up those good habits that have kept us, generally safe so far. And hopefully a combination of the vaccine and our habits will get us through and pull us through this without losing too many more people.
Yeah, echoing on what Dr. Trivedi and Dr. Williams said, there's a light at the end of the tunnel. I think the vaccine is very hopeful news that, we can kind of reach the finish line and get over this hump. I think what this pandemic has shown me is I've taken kind of like the small things for granted, giving a person a hug. When's the last time you gave someone that's not your immediate family member that you live in your house a hug? I haven't done that in over almost a year. being able to sit at a table and dine with other people, seeing people, seeing loved ones, traveling. I think those are kind of the things that I really miss. And those are the things that I'm keeping at the forefront of my mind to say that, we need to stay vigilant. You need to keep guidelines at the forefront of everything that you do, especially when, there is a light at the end of the tunnel. And I think, as a society, as a community, as people of color, we can do our best to, not only educate ourselves, but educate the people around us, our friends, our family, to prevent any further burden of this disease. Because, we started behind the 8 ball and now we're just almost catching up to where we need to be. So continue on, stay vigilant, get the vaccine.
Oh, you can't hear me. I want to thank everyone for joining in. If you like some more support, someone who needs help planning, Urban Health Group, we provide one-on-one support, but we're also going to be creating a interactive live workshop starting in February, really helping folks gear up, prepare themselves, gather all the information that we need. We don't know how long these barriers at the hospital are going to be in place, but I imagine a while longer. And one way that folks can get peace of mind is having the adequate preparation. And that's a service that we provide. Again, you can ask your doctors, whoever you're connected to, but hopefully medical professionals, on ways that you can prepare. And if you're looking for additional support, that is a resource we provide. Thank you all for joining in. Thank you, doctors, for your time and your service. I owe you guys lunch, which I'm very happy to provide. And if you guys have questions, please just let us know. All right, take care, everyone.
Thank you.
Have a good one.
You too.
Thanks.